Hello. I am pleased to greet you through Dental TV Clear Align Master Course. I'm Dr. Ji Daekyung of Seoul May Orthodontic Clinic. Thanks to the support of many people, we are finally able to offer the Clear Align Master Course online, which has been available only offline up until now. This online course will cover the key contents of the offline course. The course is comprised of a total of 20 lectures, including the ones delivered by Dr. Lee Jong-guk. Considering your busy schedule, we made sure that it could be an opportunity for you to learn important theories and practical know-how in an effective manner. We kindly ask for your interest and participation. We included what can be clinically helpful to you on our slides throughout the course. I'll do my very best. Today, I'd like to share the overview of clear aligners as a first lecture. I'm going to talk about 4 key points. Last year's motto of the Korean Association of Orthodontists was Big Change and Big Chance. I'm not saying that clear aligner alone can bring about a lot of opportunities and changes to the practice of orthodontists. But clear aligner is surely one of the hottest trends in digital orthodontics. We don't have much time, but I will do my best to deliver the basics of clear aligners. Let's begin with the principles of tooth movement in clear aligner treatment. I'll compare clear aligners in brackets. As many of you may already know, the forces used in orthodontics can be categorized into push and pull. In conventional bracket-based treatment, a nickel titanium wire is placed like this and tied with ligation wire. Then, the binding force will now move the tooth in the direction as intended. It will be moved according to the pulling force. That is same for locking like this. When you bind it with a ligation wire, it moves the tooth into the direction to which it is tied. It is the pulling force. Now you have this plastic sheath wrapped around the tooth, and if it's a clear aligner, you're going to have a pushing force in the direction that you want to move. So, tooth movement is done by pulling forces. In orthodontic tooth movement, we often talk about many types like tipping, rotation, intrusion, extrusion, vertical movement, translation, and root movement. How do the clear aligners move the teeth depending on the type of tooth movement? For some, clear aligners can have advantages, but for others, they may have some disadvantages. I'm going to explain these things. First, take a look at buccolingual movement, BL in short. Since pushing forces are applied, for broad, flat teeth like these in the anterior region, will it work well? Yes, it generally works well. The pushing force helps the teeth movement effectively. Now, let's take a look at rotation control. Again, when we deal with flat teeth, if they are pushed properly, rotation with clear aligners works better. Let's put attachment aside for now. I'll talk about those in the next or following lectures. For now, I'm just giving examples of clinical cases where we use only clear aligners. Now, if you push it, it's going to be moved, but when you have rounded teeth, small teeth, or microdontia, it's going to slip, which makes tooth movement harder. However, when there's a little bit of crowding, there are edges to push against. In this case, tooth movement can occur. Let's take a look at the MD movement. Even if it is wide, can the aligner grip it from front to back and push it side to side effectively? Not really. This kind of tooth movement is more difficult. That's why we apply attachments to use that side for a case like this. Now, the same applies to tipping. If you try to push and move it, it will slip. This is one of the disadvantages of clear aligners. Now, here's a little quiz. This is about vertical movement, intrusion, and extrusion. Which of these do you think is biomechanically easier to achieve orthodontic treatment using clear aligners? Now, I'm going to count to 3. 1, 2, 3. You answered, right? You might be thinking, oh, this is a little bit easier because it's a solid line. With an aligner, we are using the pushing force on this incisal edge. So, we will push in the tooth. It seems easier. Now we will pull out a tooth stuck inside. But when trying to pull it out, it will just slip. Not easy, right? In this case, of course, neither of these are very easy, but anyway, if you compare them, pulling it out the tooth is a little bit more difficult. In the case of torque, it's not that difficult because the pushing force can be applied smoothly in the anterior teeth. On the posterior region, however, it will slip like this. Because of the wide root area, it is a bit harder, and anyway, due to the slipping force, there can be some limitations. In the case of expansion, when pushing the lingual surface, aligners may offer an advantage, making this type of movement somewhat easier. That's the point. Now, secondly, the target tooth movement. Compared to conventional brackets, clear aligners offer a bit more control over the movement of a specific tooth you intend to move. You can think of it this way. For example, now we have this patient. So now we apply brackets. How should we treat this? We bond the brackets and place 011 nickel titanium or 014 nickel titanium wires. In this case, we'd like this tooth to move into the ideal occlusal alignment line. But does it happen that way? With brackets, these two teeth exert forces outward, action and reaction. As a result, you end up with an overjet, which then increases the overall treatment time. By contrast, with clear aligners, the other teeth can be fixed with an anchorage while the protruding tooth, the target tooth, only can be moved step by step. That is how it works. Let me give you an example. Here's another quiz. Compare the orthodontic treatment cases on the left and the right. Guess which one used braces and which one used clear aligners. On the count of 3, 1, 2, 3. The answer I was expecting was both are pretty impressive. Anyway, what was your answer? This one is the brace case, and this one used clear aligners. You might say there's not a big difference between them. If I had to point something out, maybe you'd notice that some teeth here seem to have undergone IPR, which might be a hint that it is the clear aligner case, but overall, both treatments were done effectively without any major issues. Let's look at the second example. Again, here we have a misaligned tooth. That is labioversion. With braces and clear aligners, the treatment was completed in 6 months and 4 months respectively without any issues. I'm not trying to show that it took a bit longer in the case of brackets. In order to align a tooth that is out of place, like I mentioned earlier, what did I say again? Because of action and reaction forces, when we do bracket-based orthodontics, we need to be more cautious. It is not like we cannot use braces for this case, but rather we do need to be more attentive. These teeth may come out while we are trying to push this tooth in. So, because of this action-reaction during tooth movement, unexpected tooth movements can occur, and it can cause a round trip. That, in turn, puts additional stress on the periodontium. The third point is about individualized arch shape. Typically, we prepare wires in 3 different types of arch forms. Today, I'm going to talk about some of my own mistakes related to this. I'll share 3 examples. The first case is Class 1 crowding. I'm not saying brackets are a wrong choice here. This is just one of those inadvertent mistakes that could frequently happen during orthodontic treatment. So, for this Class 1 crowding, I extracted number 4 and performed alignment and leveling. If you keep going like this, at some point after using 018SS, unwanted tooth spacing can start to appear. Was it just for me? Probably not. Anyway, such things can happen. Let's put aside diagnosis discussion for now. This wasn't an especially difficult case. But here's the point. I extracted number 4 teeth on the upper and lower jaws, and number 3 tooth was a high canine and was positioned a bit buccally or labially. The posterior occlusion was fine in the buccolingual direction. After aligning the teeth, it looked okay. Okay, so it should be done with finishing, space closure, and things like that. But then, we ended up with a buccal overjet. Why did that happen? Pulling of the canine did result in buccoversion of the premolar. So we ended up with this buccal overjet. In the end, it was my mistake. Fixing this would take additional time. Let's take a look at the third mistake. Now we have what's called generalized spacing, overall spacing in the anterior region. I'll go into this more later, but this kind of case is actually more appropriate for clear aligner treatment in terms of treatment time. Anyway, I applied brackets to this case. Now, when we do a generalized spacing treatment with brackets, we usually start to bring the teeth together. We level the alignment, consolidate 2 teeth, then 3, then 4. This process is called space consolidation. After that, we pull the remaining teeth, usually the ones behind the second, or the third in mass. This takes quite a bit of time. In comparison, you can get controlled tooth movement with clear aligners, which is biomechanically more advantageous. Still, in this case, we applied brackets. There should be no problem. We can finish orthodontic treatment after a little bit of detailing. Let's take another look. If we look at it closely, we see that overjet occurred on this side as well. What should we do about it? That's a big deal. But anyway, after going through all the difficulties, we got a good occlusal. If you have any unintended tooth movement like an overjet, you're going to have some kind of wasteful element that you're going to have to spend more time and mechanics on, like a round trip again. In that sense, it's not like clear aligners are always better, but they can offer certain advantages in some situations. In general, we have tapered, ovoid, and square types, but not everyone fits into these 3 categories. Do you have wires prepared in all shapes and sizes? Even though I focus solely on orthodontics, it's not easy. And that's how common mistakes, like the 3 cases I showed earlier, happen. And then lastly, I used the word proactive in the treatment planning phase. In the case of bracket orthodontics, it tends to be reactive. For a patient's visit every 4 weeks, we check the movement and respond accordingly. But with clear aligners, the treatment planning is made in the form of a setup in advance. The final occlusion is set from the beginning through a treatment setup. We assess whether the planned tooth movement is feasible from the front and from the side. We check if the transition from the original state to the setup is realistic. In this way, you proactively establish a treatment plan, verifying whether the movements are achievable. So, how was the first lecture today? There is one question I am asked a lot during lectures. Can't we just send a case and let the clear aligner system take care of it like a self-driving car? But in reality, that's not how it works. That's why we provide a 20-session master course to train dentists. The role of dentists is really important in clear aligners. Whether it's Invisalign or Magic Align, when the first setup is made, it would be great if it were perfect from the start. But usually, we need to go through revisions, first, second, sometimes even up to the fourth or fifth revisions. These revisions help us reach the ideal occlusion. Then, as mentioned earlier, we examine the setup from the front and the side, and check occlusal views to judge whether the tooth movements are reasonable. And who makes that decision? It will be you as an orthodontist. In the beginning of the lecture, I mentioned change and chance. Clear aligners alone are not going to change all of our orthodontic practice. But I hope that some of the things that I've talked about today and some of the things that I'm going to talk about in the future could be a small but important chance for you to change things for the better. How was the first session of Clear Align Master Course? There may be some things I could have done better, but I'll do my best to bring you more valuable and informative lectures in the future. Advanced topics and hands-on courses that couldn't be covered online will be provided through our offline lecture. I look forward to meeting those of you who are interested at one of those sessions. Please continue to look forward to upcoming lectures. That is all for today. Thank you.